everyone, my name is Katie Nat, pronouns she, her, and hers, and I'm a fourth year psychology major with a child development minor. I work at Campus Health and Wellbeing as one of the Pulse team leads. Working with resident advisors in the past has shown me that the work you all do is so important to student success and transition. A big part of supporting students is knowing where to refer them to help with their specific needs. Keeping track of all the resources available on and off campus can often be challenging and overwhelming. So today I'll be showing you how to navigate through campus health and wellbeing resources and services on our website so that you can easily support students in the future. Okay, so here we have Googled Cal Poly Campus Health and Wellbeing, and we're gonna click on it. And here we are on the main homepage, and this will be your point of reference for any questions regarding medical, counseling, or well-being services. This is a good time to mention that within student tuition and fees, you already pay for many of the services offered at the health center. Some services can incur additional costs, and I'll be pointing those out later. But if you ever need to see a physician or therapist, the health center should be your first stop. Our on-campus health center is a fully functioning medical and counseling clinic. Our 16 medical providers, 5 registered nurses, and 20 therapists work hard to support the health and well-being of around 280 Cal Poly students per day on the medical side and around 80 Cal Poly students per day on the mental health side. And while we can provide comprehensive care to students, there may be times when we need to refer you to a specialist outside of campus health and well-being. Whether this is for mental or physical health, you must use your own insurance at that time. Your tuition and fees only cover services offered by Cal Poly. If you need services outside the health center's scope, you will need to discuss that with your own insurance company. So with that, we're going to begin by looking at the health services website. Medical providers, nurses, and support staff work within this area to provide care for students. So here I'm going to show you an image of the health center building. If you ever have trouble finding it, we're building 27 on the map. If you can locate the recreation center and climbing wall, we're tucked back and to the right of the rock wall. You'll see our brick and concrete building. If you enter at ground level, you'll find health and counseling services. If you're looking for well-being services, look right under the health center lettering on the building and there's a ramp. If you go down this ramp, you will find peer wellness programs and SAFER's advocacy office. Here under health services, we can see important updates. Required immunizations are different this year for new and incoming students. I recommend being familiar with the immunizations page to help address any questions. There's also a frequently asked questions webpage that helps address most concerns. So here we are on the FAQ page, and there's a bunch of questions that students may ask. Also listed are the current hours of operation. Right now, we are offering telehealth and in-person appointments. For your safety during the pandemic, please call ahead to make an appointment. And here is the phone number. Times of operation and other protocol are ever changing during this public health crisis, as I'm sure you all know. So please refer to the website for any updates. Additionally, if you or a student ever need to speak with someone after hours, here's the number for the after hours nurse advice line. As always, if you are experiencing an emergency, please call 911. Before I dive into what health services offers, I'm going to show you how to get to your health portal. This is where students can make appointments and check messages from providers. We're going to click here on the side. So here we are in the health portal. There are several things you can do here, like upload your required immunizations, read messages from your providers, see lab results, and schedule appointments. Again, normally you would schedule appointments here, but because of the pandemic, appointments are only being scheduled over the phone. So call this number to schedule an appointment. Now we're going to take a look at the medical services that are offered, including which services are free and which services may have an additional fee. All of these services are available on campus. Students can access these services at no additional charge. So we have primary care and nursing care. So if you're experiencing flu symptoms, for example, you could go to these. There are routine laboratory tests such as for strep and mono. There are also routine x-ray procedures. There's sexual health care such as birth control consultations. There's also a travel clinic for if you plan on traveling out of the country and need to know if you need any new immunizations. And then here are the services that are available to students with an additional cost associated. All additional charges will be posted to your student account as a health and counseling charge to maintain your privacy. You would pay for these charges just as you would pay for tuition and fees. So some of those services include certain lab tests when specimens are sent off campus. So for example, there would be a chem panel or a pap smear. Also, immunizations will cost extra, orthopedic supplies, STI testing, required physical examinations such as for an off-campus job, and pharmacy items. There is also a pharmacy on campus where you can get prescriptions filled or buy over-the-counter items. The pharmacy offers lots of drugstore items at the lowest price possible, such as Band-Aids, Advil, face wash, and so much more. Like other charged services, students will pay for these items through their student account portal. So here's the price list for some of the pharmacy items. So we can see something like Dayquil is only $2, which is so cheap. And you can also transfer your prescriptions from your at-home pharmacy to the health center. Please note that the health center does not bill any medical insurance. However, prescriptions are usually less or equal to most copayments. It's worth checking to see if the Cal Poly Pharmacy carries your prescription. Just call their number and ask them if they carry your prescription and what the cost will be to you. If you have insurance, you can always ask for a receipt that you can submit to your health insurance for reimbursement. If you're taking a prescription regularly, it's more convenient to send it to the Cal Poly Pharmacy and just pick it up on campus after class. So now we're going to look at the laboratory site. As I mentioned earlier, we do have an on-site laboratory, and here's some information on how to prep before a test and the price list for common lab tests. And here is the specialty clinics. We have specialty clinics where you can go for sexual health visits, the travel clinic for if you plan to travel and need special vaccinations, and this is also a place where you can get physicals for something like a job or other outside agency. You can also get vaccinations at the health center, and the prices are conveniently listed right here on the page. So you can browse through these. Campus Health and Wellbeing aims to ensure trans and gender diverse students receive the highest quality care in a supportive and respectful space. On this page, you can find resources about medical and counseling services, name and gender change, and other resources pertaining to gender-affirming care. Now we're going to look at the forms page. So to prioritize student safety and confidentiality, we often require forms to process information. On the forms page, you can find all of our forms. One of the most common forms requested is the authorization for disclosure of protected health information to parents, which gives your supporter permission to access your medical records. I know it's a super long name, but what it really means is that it allows your parent to talk to your provider about your health. Please read all forms carefully to submit them properly. If you're looking for more resources on specific health topics, you can find this information on either the Resources or About tabs of the menu bar. So now we're going to shift gears and look at counseling services. This is the Counseling Services homepage, which has important announcements as well as basic information about counseling services, including information about what is being offered during summer of 2020. Counseling Services offers a wide variety of services, including individual, group, or couples therapy, as well as urgent appointments and mental health skills-based workshops. Students who feel that they are in crisis or are in significant distress should contact Counseling Services via phone and mention that they need to be seen urgently, so they can be scheduled for a crisis or triage appointment. This will happen within that same day. There is also an after-hours psychological crisis line available free of charge that can be reached just by calling the main Counseling Services number. If students don't need to be seen urgently but would like to meet with a therapist to discuss counseling options, they can call and ask for a screening appointment. These appointments are an opportunity to briefly speak with a therapist about what is going on and for the therapist to discuss what counseling options may benefit them. This may be short-term, individual therapy, outside counseling, group therapy, or other services in campus health and well-being. Although all therapists in Counseling Services are generalists, some also specialize in concerns like disordered eating, obsessive-compulsive disorder, alcohol and other drug use concerns, and gender-affirming care. Because counseling has a wide variety of treatment options, it is helpful to review what is available on our website prior to your appointment so you can mention your interests to your screening therapist. There is also a newer program called Let's Talk, where you can drop in via Zoom with a therapist for an informational conversation. Some reasons to drop in may be to discuss issues with residents or to review basic coping skills to deal with stress. This office hours style consultation is available to all students and resident advisors. And you can feel free to take a picture of that so you have it. So during busy times of the quarter, you may need to wait longer to meet with a therapist for an initial screening, but most students are seen within a week. If you're waiting for an appointment, Counseling Services has several helpful resources that you can access in the meantime. Here are some great resources to take advantage of while you wait for your appointment. I'd like to note the Peer Health Education Program, which is what I will be discussing next, and where I work. I also want to leave you with where to find all of the crisis hotline numbers. So if you or someone you know needs immediate assistance after hours, they will know who to contact. Our health center after hours number will lead you to a real person that can help support you in a crisis. Some other great numbers are the SLOW hotline, a text crisis line, as well as some other lifeline services. They also offer many language options in order to serve all populations. Additionally, like medical services, if it is an emergency, please call 911 or go to the emergency room. So now we're going to preview what Wellbeing Services offers students. Like I said earlier, we're located in the lower level of the health center, so walk down the ramp in front of the health center and you will find us. At the front desk of Wellbeing Services, you'll first notice that we offer lots of free health promotion items. Students come for the free condoms, lube, Scantrons, informational handouts, and stickers. Behind the counter houses our Wellbeing Services, consisting of many programs and services that you might already be familiar with, such as Pulse, Safer, and the Food Pantry. Overall, our services aim to promote well-being and develop individual, group, institutional, community, and systematic strategies to improve health knowledge, attitudes, skills, and behaviors of the Cal Poly community. On our website, you'll find more information on these resources and services. Our 4 health educators support and guide the peer wellness programs. Additionally, our health educators provide presentations and outreach campaigns relating to alcohol and cannabis and other drug prevention education, as well as gender and power-based violence prevention education. So now we're going to look at SAFER. And SAFER is Cal Poly's primary confidential resource for addressing sexual assault, intimate partner violence, domestic violence, stalking, sexual exploitation, and harassment. All SAFER advocates appointments are held in the health center. while SAFER's prevention education outreach efforts are located in the UU. So here we're going to look at the peer wellness teams. The peer wellness teams are made up of 6 different focus areas as well as coaches. So like me, there are close to 70 students who volunteer for campus health and well-being. These are the teams that work within well-being services. First, we're going to discuss EROS, which is the sexual health team, and they focus on the topics of safe sex, STI testing, and the Center, which is an off-campus sexual health clinic that offers free sexual health care. And next we have REAL, which is the mental health team, and they focus on the importance of self-care and mental well-being. And next we have the HEAT team, which is focused on fitness and nutrition, which is my team. And we look at healthy eating options on campus, eating disorders, the rec center, and benefits of exercise. And next we have TLC, which is the drug and alcohol focused team, and they talk about safe partying and bystander intervention. And then there is the wellness ambassadors, and they strive to improve the overall health and well-being of students. And finally, we have Mustangs for Recovery, and they offer recovery meetings for those suffering with addiction to drugs or alcohol and looking for peer support from others going through the same thing. And they also have Zoom offerings this coming quarter. So now we're going to discuss the coaches, and they offer one-on-one peer counseling on any of the areas I discussed before. It's still to be determined if there will be one-on-one consultations available in the fall, but there will likely be small group offerings over Zoom in the fall. Come winter and spring though, if you're looking to talk to someone but aren't ready to speak with a mental health professional, or you're waiting for an appointment with counseling services, meeting with a coach may be a great option. You have the opportunity to sit down with a peer who has been in your shoes and is there to help. Sometimes it just feels nice to have someone to listen and understand. And that's what the coaches are here to do for you. So all of these teams have events throughout the year, and you can find out when those events will take place right here. So here's a calendar of everything going on within campus health and well-being. Next, if you're interested in becoming a part of our team, check out the Get Involved link where you can find more information and a link to sign up to be a volunteer. Now we're going to talk about the food pantry, and the food pantry is a resource that allows students to come in and fill a grocery bag with food for free. The food has all been donated and consists of canned goods, snacks, sometimes fruits and vegetables grown on campus, other produce, diapers, baby formula, feminine products, and even more. Food items vary by what has been donated, so always feel free to call and ask if you are looking for something specific. Pulse also has a massage chair which is free, and you can make an appointment here online. Unfortunately, it is closed right now, but keep an eye on the website to see when it opens back up and grab an appointment. This is a free and fun way to relax before a test. So I'm going to show you how to get to the appointment page for future reference. So here is where you can make an appointment when the massage chair is open. And finally, if you ever have any questions or would like to contact us, feel free to call or email. Since a lot is unfortunately up in the air right now, it's important to keep an eye out for updates and changes. Be sure to follow us at MyCPWell to see posts about updates and changes. We're on Facebook, Twitter, and Instagram. There are also fun ways to interact and win giveaways during the school year through MyCPWell. Additionally, you can sign up for our weekly newsletter to stay up to date and get information about events, updates, and when we are hiring so you can become a part of our team. Check out the link in the description below to sign up for the Campus Health and Wellbeing newsletter. We can't wait to see you all back on campus, where you can find us in the office, presenting in classrooms, in a scheduled one-on-one consultation, or out boothing on campus. If you see a Campus Health and Wellbeing or Safer booth, be sure to stop by, because we're always giving away free information, free swag, and often free food. To close this out, I just wanted to acknowledge coronavirus. I know that COVID-19 has affected us all in its own way, and I'm sure you didn't imagine something like this would impact your experience as an RA. One of the best things we can all do is be up to date and vigilant in our fight to reduce the spread of the virus. When you rejoin the Cal Poly community and San Luis Obispo community, please make sure you are adhering to the local policy and getting informed from credible sources like the CDC, WHO, and the university website, coronavirus.calpoly.edu. This website will be updated on a continual basis. It will also include local resources available to you as a Cal Poly student. Thank you all for being here today. I hope you learned something new and will spread all this information to your residents. Bye.